Thank you very much. I'm going to share my screen. So give me a second here. Okay, so today's topic is prevent and reverse the heart disease. And some of you have attended our actual clinic setting seminars before, so it may be a bit of a review. But so that we can get everybody on the same page, we'll go through some the basics, the foundation of the preventing and reversing the heart disease with the plant-based nutrition. And as the meeting progresses, we can get into a lot more details about different techniques and things that you could do to further enhance actually reversing the heart disease. And I'm sure, just like that she has said, that you've known people, whether it's your family member, yourself, or community, who have had the heart disease, as this is one of the most common disease, and it's but something that we can definitely prevent and also reverse. So just if you're new to the group, just a little bit background about myself. I practice, orthopedics and spine surgery and stem cell therapy for over 20 years. But I transitioned also into a longevity medicine as I gotten a tremendous amount of exposure to the radiation during the surgical practice as we were developing a lot of minimally invasive techniques. And then also lost some of my key colleagues and really good friends to cancer. Some of them were non-smokers who had developed lung cancer, and I myself, quite fearing, I went into a journey of doing a lot of research on how to prevent and reversing the cancer more naturally. That's how I came across the whole food plant-based nutrition for reversing many of the disease. So that is a little bit a background about myself. And that's how I, initially as a surgeon, and transitioned into something that's more of my passion, which is longevity medicine. I always tell people that I want to, humans have the ability to live until 120, but most people, they damage their own body far before to even get to 100. And so my mission is to see if I can get to at least 100 and hopefully to 120 living in a healthy way. And so I'd like to share the information that I've gathered, because as a physician going through medical school, never really learned all this topic in medical school, which seems quite ironic, because we learn to manage the disease rather than actually trying to cure the disease by addressing the cause. And that's why I say heart attack is a choice. Some people think this is, harsh. Well, it's not my fault that I had a heart attack. Well, once after this talk, that you will know that heart attack really is a choice, because you can actually make a decision how to reduce the risk, and almost just about 95 to 99% of the heart attack and cardiac events can be prevented. But at least that's a good news, because you can prevent heart attack and you can also reverse the heart disease. Okay? In U.S., 1 in 3 deaths in U.S. is due to heart disease, which is a tremendous number. And it's not only the #1 killer in America, but now it is #1 killer of both men and women worldwide. And there's a 1 death from cardiovascular disease every 40 seconds in this country. Somebody has a heart attack here in America every 30 seconds, stroke every 40 seconds. And then annually, there's about 2 million heart attacks and strokes per year in this country. And if you combine the stroke and, all the cardiovascular disease, that's about 800,000 people dying every single year, and especially in 2017. And so during this presentation, then there's about 180 people who will be dying from cardiovascular disease while we're having this discussion, which is really sad. And this is the listing of the top 10 causes of death in U.S. in 2018. Really hasn't changed for many years. And heart disease, of course, being #1. But all the other disease that's listed here can pretty much be prevented and even be reversed. But also right now, I know that the COVID-19 is a huge topic, and I'm sure you're just bombarded with all the information, whether it is the social media or every time you turn the news. But it is an important topic, especially with the chronic disease. As we now know more information about the COVID-19 than before, and most people who suffer from severe course from COVID-19 or even death, they tend to have pre-existing conditions and the chronic disease, especially cardiovascular related disease. So if you have high blood pressure or cardiovascular disease, you're 2 to 3 times more likely to suffer from a severe course. And then also you're 4 times likely to end up in ICU. And if you end up in ICU and get on the ventilator, 80% chance that you're never going to come off the ventilator. And so we really should be focusing on the preventing, and it's never too late, as you will see, that you can quickly start reversing the high blood pressure and cardiovascular disease. And same thing with diabetes. And of course, COVID-19 attacks the pulmonary system. So if you have COPD, chronic obstructive pulmonary disease, like the emphysema, most commonly from smoking, they tend to have the highest risk factor. Okay? And this is a picture of a beautiful hospital, in Plano, Texas, which they have been expanding for every few years. Over the past 10 years, I think they've spent anywhere from $300 to $400 million in renovation and expansion. As our technology evolves, as we are able to do Zoom in order to have a meeting, you would think that the hospital should be getting smaller and smaller. Instead, it's only getting bigger and bigger, especially when it's related to heart disease and cancer. And part of the reason is look at how the physicians are actually treating. This is a breakfast tray of the hospital that's affiliated with that heart hospital, a patient who had a heart attack the night before, and this is a breakfast tray. And this is basically heart attack causing food served to a patient who just had a heart attack at the hospital. But doctors don't do any better. This is a picture from a doctor's lounge, and I actually got in trouble for this because I put this on the social media. But and the doctors are eating the carcinogenic, group 1 carcinogenic, the processed meat along with the eggs. That's not enough. So then they're adding cheese to it, and then with the refined carbs, with sugar. And this is the type of food that is served even in doctor's lounge. So it's not just for the patients, for people who are visiting. And so, just because doctors say so doesn't mean you should follow their recommendations, right? You need to do your own research. Even anything that I say, you should go back and try to research it for yourself and then apply it to your health and to your life. And as this commercial from, I think, 50s or 60s, where doctors, more doctors smoke Camels than other cigarettes. And so that just because they're doctors doesn't mean they know everything. And this is the state of American health care, where doctors are, just mopping the overflowing sink. And the only person who can actually turn off the faucet is yourself. So really, in America, it's not American healthcare. It's really American sick care that the hospitals and doctors are practicing. Okay? So back related to the heart disease, the major risk factor for heart attack and stroke, number 1 is a high blood pressure, which can be prevented and even be reversed. And then also diabetes, high cholesterol, smoking, and then the obesity. Every single one of them that you have a complete control over in order to actually reverse the course of heart disease. But 60% of American adults have at least one of these risk factors, which is pretty tremendous number. And then, as I mentioned, high blood pressure is the number 1 risk factor for heart attack and stroke. But 1/3 of the American adults suffer from high blood pressure, and 1/3 doesn't even know that they have a high blood pressure. And 1/3 that's actually being treated can't keep the blood pressure under 140/90. So even they're being treated, that they still have high blood pressure, which further increase the risk of heart attack and stroke. But this is not disease just for the adults. If you look at what all the kids are eating, right? So what percentage of the kids between age 12 to 14 years old in US do you think that have early signs of atherosclerosis in their blood vessels? Okay, so you can write it in the chat. And when I looked at this number, I was actually quite surprised because 65% of the kids between age 12 to 14 years old already have early signs of atherosclerosis. And 8% of the children actually have even advanced lesions. And it's sad to really start your life at early teenage years with the early signs of heart disease already. But it's not just the teenagers. And what they're finding is that sadly, some of the fetuses are actually developing fast streaks, which is really the early signs of atherosclerosis. So before they're even being born, and it's really based on mom's cholesterol level, the fetuses are already developing heart disease. And so something that we really need to be thinking about. And the main factor for heart disease is not just the different types of lifestyle, but and lack of exercise and things like that. But the number one cause is the diet, because American diet and the Western diet, which we are also exporting to all the other countries around the world, 53% of the calories comes from the processed food, 32% from the animal-based product, only 11% from fruits and vegetables. But almost 50% of the fruits and vegetables consist of French fries and ketchup. And I can't believe that ketchup is actually considered a vegetable in this country. And this is one of the main reasons why we're developing so many different types of chronic disease. And this disease is causing the obesity, heart disease, diabetes, cancer, and many other chronic disease. Okay? And so let's look at the anatomy of our artery, and which is the basis for the heart disease. As you can see in the normal one, and if you do a cross section of the artery, it's completely open, and versus completely diseased atherosclerotic artery. But the important thing to note here is the black inner lining of the artery. This is called endothelium, or the inner lining of the artery. This is one of the most important structure in our body, because they produce some of the most important molecules that allows us to maintain a very healthy cardiovascular system. And we'll be talking about it. So if you do another cross section, it's the inner lining, which is called endothelium. This allows the blood to flow very, very smoothly. So it's like a non-stick pan where you put something on and it just glides over. It doesn't stick to it. But if you beat on it for a long time and then try to cook something on it, it's just everything is going to stick to the pan. So this is basically what happens to our blood vessel. Okay, and so where you develop the atherosclerosis, and if you look at this cartoon, the yellow dots are the cholesterol, specifically LDL, what's considered the bad cholesterol. And so when the endothelium gets damaged and there's crack, along with inflammation, the cholesterol from the bloodstream will infiltrate into your blood vessel. Then your immune system recognizes it. Then your white blood cells also enters and become something called macrophages. And then they start gobbling up the cholesterol and then become something called a foam cell. And then foam cells release certain chemicals that basically causes a necrosis. And then also really, along with the inflammation, thins out the plaque. And then if you look at it, it almost looks like a pimple inside the blood vessel. And this really thin layer of the plaque, as the blood flows through, it cracks the outer layer. Then that actually causes the blood clot to initiate. And then if it gets big enough that completely occludes the blood vessel, that's what happens when it's actually a heart attack or stroke. And so number one cause of the heart attack and stroke is actually the blood clot inside, because there's a breakage of the plaque. Okay? So in order to prevent heart attack and then also to reverse the heart disease, we need to avoid the injury to the endothelium. Okay? That's the first thing that we got to do. And then avoid the food that actually elevates the cholesterol, because majority of the cholesterol is made by our liver, but anything else we add to it, such as additional cholesterol or saturated fat, can further elevate the cholesterol. And along with inflammation, that will infiltrate into our blood vessel, causing the plaque. And so we also need to make sure if you're trying to reverse the heart disease, you really got to think about lowering your intake of fat. The total amount of fat should be less than 10%. Of course, it's different if you're trying to prevent it, and then you can be a little bit more lenient. But what I'm going through today is specifically you already have cardiovascular disease and you are trying to reverse the heart disease so that you don't have another episode of cardiac events such as heart attack or stroke. And also along with that, decreasing the inflammation. And we'll talk a little bit about the TMAO. It's called trimethylamine oxide. And then also increasing the food that helps you produce more nitric oxide, which is considered the most important molecule or miracle molecule in our body to maintain healthy cardiovascular system. And then also consuming more food that has antioxidants. Okay? And chronic inflammation is considered the silent killer, because also you can't develop heart disease and many other chronic disease without inflammation. But not only it causes a cardiovascular disease, but it also causes many other diseases, even such as autoimmune disease and other neurological disease and inflammation. So it's really important to reduce the overall inflammation in our system. And one of the best way to do that is through a diet, what you eat. So American Heart Association did a study where they compare their own recommended diet, American Heart Association recommended diet for patients with the coronary artery disease, along with the plant-based diet. And they looked at 100 patients and looked at it for about 8 weeks. And the end point of the study is to see if they're able to reduce something called high sensitive CRP. And that is a biomarker for inflammation, especially in your blood vessel and vascular system. And what they found was that the plant-based diet was able to significantly reduce the hypersensitive CRP in patients with the coronary artery disease. But their own recommended American Heart Association diet could not reduce the inflammation. Okay? So then why are they recommending American Heart Association diet? And same thing goes with the Diabetic Association as well. And I briefly mentioned the TMAO, and this is a important molecule for patients with the cardiovascular disease because it's associated with the most severe cardiovascular disease patients. So if you have high level of TMAO in your blood, and you're more likely to develop twice as much of the risk of developing heart attack, stroke, and other serious cardiovascular problems. Also, TMAO has known to increase inflammation and increase the deposition of the cholesterol in your arterial wall and directly causing the atherosclerosis and thrombosis. So you really want to limit the amount of TMAO that you produce. But so how do you produce TMAO in your system? If you consume food that has a high concentration of choline, lecithin, and carnitine, and when you consume it, and if you have certain type of gut microbiome, and it converts it into a TMA, trimethylamine, that gets oxidized in your liver, and then it starts to attack your blood vessels and cause the cardiovascular disease. But the study have shown that it's the meat consuming people that contains the bacteria, specific type of bacteria that produce the trimethylamine. And what type of food contains a lot of the choline, lecithin, and carnitine? They're all pretty much animal-based products. The eggs, the meat, the poultry, and dairy, and they all tend to contain a high concentration of choline, carnitine, and lecithin, and they increase the production of TMAO because if you eat this type of food on a regular basis, then you are going to be developing gut bacteria that is more likely to develop the TMAO. And studies have shown that that if you are pretty much plant-based, then you don't have the gut bacteria that actually produce the TMAO. So I don't know how they got, one of the vegans to do the study. They fed a piece of steak to a vegan, and then their body did not necessarily produce the TMAO. And a lot of the study was done at the Cleveland Clinic, and now very strong association of high elevation of TMAO with coronary artery disease. Also, within the meat, it contains the bacterial toxins, the endotoxins, that also triggers the inflammatory process in your vascular system. And they're not necessarily destroyed by cooking or even in your stomach by the stomach acid. So it's something that needs to be aware of also. So overall, meat-based diets tend to increase the biomarkers of inflammation, while the plant-based diet is inversely associated with biomarkers of inflammation. Okay? So steps to lowering the inflammation is eliminating all types of meat, beef, pork, lamb, fish, chicken, egg, and dairy products. And especially if you're trying to reverse it, you want to be as strict as possible, and eliminating the oil, because oil contains significant amount of saturated fat, and then also it has a very high omega-6 to omega-3 ratio, which will lead you to more inflammation. Okay? Eliminating all the processed food, I think we all know that it increases inflammation. It's not good for our health. And then also really adding on a lot of raw fruits and vegetables, greens, and then also legumes, which are beans and lentils. A large amount of water. I drink approximately about a gallon of water each day. I think most people live in a state of dehydration, so make sure you consume a lot of water. And then also make sure you have healthy omega-3 in your diet. And adding foods such as grounded flax seeds or chia seeds or hemp seeds, and if you can't do that, then the study are showing that the fish oil is really not doing anything and are not reducing the cardiovascular disease, because there are a lot of toxins, and fish oil are not very pure. But you can get more natural sources of omega-3. Okay? And also, optimizing your cholesterol level is very, very important. Now, it's beyond just keeping it at the normal level. If you go to your family practitioners and your internist, they do a test, and then they say your total cholesterol is less than 200, bad cholesterol LDL is 100, great, high five you. That's not enough. Okay? And you want to reverse the heart disease. You want to get that LDL to be low as possible, less than 70, and then total cholesterol to be less than 150. And also 20 to 30% of the population have something called lipoprotein A, and it's a genetic, and so this makes it a little bit more complicated, and then your risk of developing cardiovascular disease increase, and the normal value is less than 30, but you definitely want to try to have it under 10. And then also there's a different degrees of the lipoprotein A somebody can have. Okay? And this study has shown that with the patients who had coronary event and who has cardiovascular disease, if they're able to lower their bad cholesterol LDL to the lowest level possible, less than 70, you really reduce the risk of the another coronary artery event. And if you can get it down to 30, then you basically have completely reversed and reduced the risk of another cardiac event. And this study showed that also by lowering your cholesterol level, you can really also improve your endothelial function as well. And the inner layer of the artery that produces the nitric oxide, which is, again, considered one of the most important molecules. And then also sometimes people say, well, you know what, I've been doing good, so I'm going to cheat. Well, if you're trying to reverse the heart disease, you may want to reconsider, because even a one single meal, high-fat meal, can really cause endothelial dysfunction, and it can last up to 4 to 6 hours. And it is during that time that you can also potentially have a cardiac event. And so every meal really counts. But if you eat standard American diet, you have it, high-fat diet for breakfast, so your blood vessel is basically dysfunctional for 4 to 6 hours. Then you have lunch, then dysfunctional for another 4 to 6 hours, and have dinner, it's dysfunctional for another 4 to 6 hours. So pretty much all day long, your artery is not functioning properly, and you're basically damaging the inner layer constantly. So that's something that you need to think about. And I get these questions all the time. What kind of oil is healthy? There is no such thing as healthy oil. One may be better than the other, but overall, every single oil that's tested has a negative effect on the endothelium and cause endothelial dysfunction. They also every single one of them, including the olive oil, tend to cause inflammation because it still has high omega-6 to omega-3 ratio, and we want that ratio to be 2 to 3 to 1. Okay. And in order to maintain healthy arteries, as I mentioned, we got to keep our nitric oxide level up. And nitric oxide was discovered and described by 3 American scientists who won the Nobel Prize in 1998. And it was one of the signaling molecules for your cardiovascular system. We now know that it has many other functions, but at that time it was considered the miracle molecule. Because it is critical, it plays a critical role in circulation and smooth blood flow. Also, it is your body's strongest vasodilator. So if you're active, you need to increase more blood flow. You need to produce nitric oxide so that your blood vessel can dilate, so more blood and nutrients and oxygen can flow through. And then that obviously will also help you decrease the blood pressure and increase the blood flow throughout your vascular system. But also nitric oxide plays a very important role preventing the platelet cells from sticking together and forming a blood clot. So as an example, if you cut your skin, you get that scab, and you want your skin to clot so that you stop the bleeding. But you don't want that to happen inside your blood vessel, right? Because if it does, then it completely occludes it. Then that's how you develop the heart attack and stroke. And majority of the heart attack and stroke is caused by the blood clot, and not necessarily your atherosclerosis completely closing. And that's a very small percentage. And so nitric oxide naturally reduces the #1 cause of heart attack and stroke. And also it plays a very important role in activating the stem cells, and especially the endothelial progenitor cells. So the stem cell for the inner lining of the artery, and it actually activates them. So and that's what, without the nitric oxide, you can't activate the stem cells. Then you're you cannot repair and regenerate the endothelium, and unable to reverse the heart disease. And also nitric oxide also plays a very important role preventing the thickening of the arterial wall and decrease the inflammation. Also destroys the foam cells, the very inflammatory cell, the white blood cell that I talked about, that produces the certain chemicals that really thins out the layer of the plaque that could potentially be torn and develop the blood clot that leads to the heart attack and stroke. So nitric oxide also plays an important role destroying that the foam cells. But the problem is, as we age, we lose the ability to produce nitric oxide. And more people are now, scientists are realizing how important the nitric oxide is. And there are over 300,000 to 400,000 scientific articles now that have been published related to the nitric oxide. But as we age, we lose the ability to produce nitric oxide, because by the time we're 40, we lose about 50%. By the time we're 60, we lose about 85% of our ability to produce nitric oxide, because where it gets produced. It's produced, as I mentioned, in the inner layer, which is the endothelium. But as we age, we damage our endothelium and develop atherosclerosis and lose the ability to produce nitric oxide. And this is part of the reason why we age and then we develop all this chronic disease. But the good news is that by working on optimizing your diet and then your activities level and lifestyle, you can slow down the decline of the nitric oxide production. And the blue line shows that with good diet and exercise, you can slow down that process and produce more nitric oxide. Okay? And and a very important way of doing that is consuming a lot of antioxidant food, and then also a food that helps you produce nitric oxide, which is a dark green leafy vegetable. And I think dark green leafy vegetable is one of the most magical superfoods that you can easily get at your grocery store, and they're extremely inexpensive. But the protocol is typically eating them about 6 times a day. And then also adding vinegar, because the vinegar has an acidic acid that also stimulates the enzyme that produces nitric oxide. And so, whether it's a balsamic vinegar, it doesn't have to be balsamic, but any type of vinegar throughout the day will also help you produce more nitric oxide as well. So what are the dark green leafy vegetables? They're like arugula, asparagus, beet, green beet, bok choy, broccoli, kale, Swiss chard. All these tend to contain a lot of nitrates. But if you want the specifics, then the arugula pound per pound contains more nitrate than any other dark green leafy vegetables, followed by rhubarb, cilantro, and butterleaf lettuce. And so, and a lot of people think, it's kale. Actually, kale contains actually less than beet. And then a lot of people think beet contains a lot of nitrates. Well, if you drink beet juice, because they're concentrated, but at the same time, we don't recommend juicing because you lose all the fiber. And then also it contains a lot of, elevates your blood sugar level much, much higher. And so, but overall, strongly recommend eating a lot of dark green leafy vegetables with every single meal. And especially if you're trying to reverse it, you really got to be bathing your artery with the nitric oxide all day long. And the way we do this is through our nutrition pathway, which is the nitrate pathway. And so the food that contains a lot of nitrate gets converted into nitrite and nitric oxide. But it's very important to chew your food, because first place it actually gets converted to nitrate to nitrite is on your tongue. It's the bacteria in the posterior third of your tongue. And when you chew the food, that it mixes with the bacteria and then reduces the nitrate to nitrite. That's the step one. And then once you when it gets to the stomach, your stomach has to be acidic enough for the nitrite to become nitric oxide. And therefore, we strongly recommend against utilizing antiseptic mouthwash that basically kills all the bacteria in your mouth. Also, using acid reducers like the Prilosec, Nexium, and Prevacid. The study have shown that these two type of products will increase risk of developing cardiovascular disease because it limits your ability to produce nitric oxide, even you're consuming the food with nitrates. So we definitely recommend against it. But also the proton pump inhibitors like Prilosec, Nexium, and Prevacid, not only it reduces the acid in your stomach, it also produces certain chemicals called AMDA that directly inhibit the enzyme that produces the nitric oxide. So we definitely recommend against it. And so by elevating the nitric oxide, I mentioned that you are going to increase the stem cells within your blood vessels. So the study have shown that these stem cells can regenerate the endothelial cells. That's how you're able to actually reverse the coronary artery disease. And the study have shown that the people, the group of population that has the lowest amount of cholesterol level also tend to have the highest level of the stem cells inside their blood vessel. And then also this study shows that by eating more vegetables and eating a lot more dark green leafy vegetables, you can increase the stem cells that are circulating throughout your blood vessel. Okay? And this study published in New England Journal of Medicine showed that the more you have the endothelial stem cells, less likely that you would have a cardiovascular event or even death from cardiovascular causes. And so you want to do everything you can to increase the stem cell level, which means you have the ability to reverse the cardiovascular disease. And then also exercise enhances the endothelial function, because by exercising, you increase the blood flow that increases the stress a shear stress to the endothelial cell, the inner lining, that stimulates more production of the nitric oxide. So this is at the molecular level why the exercise is good for your heart. And these are the things, again, that limit and decrease the production of nitric oxide, which is the standard American diet, atherosclerosis themselves, aging, sedentary lifestyle, antibiotics, antiseptic mouthwash, which both of them tends to destroy the microbiomes and bacteria in our system, acid reducers like the proton pump inhibitors, and smoking. And we've known for a long time it actually damages the endothelium. So when you have high cholesterol and you have endothelial dysfunction, along with oxidative stress and inflammation, these become the main source and cause of atherosclerosis and coronary artery disease. Now that you know that what the causes are, if you can decrease the cholesterol, I misspelled that, and then restore the endothelial function and decrease inflammation, you will be able to not only prevent but also reverse the coronary artery disease. So then how do you go about reversing the heart disease? Is that by so many Americans are having heart stents. Are you able to reverse the heart disease by having a stent? Obviously not. It's like putting a Band-Aid on, right? It's only effective if you're acutely having a heart attack and then they're able to open up the blood vessels. But most people, 80 to 90% of the time, it's done to a patient who has a stable coronary artery disease. But the studies showed that there's no evidence of benefit for preventing death, non-fatal heart attack, or unplanned revascularization, or even a chest pain with stent. And why are we having the heart stent? So many people are having it done, every single year in this country. Well, there's an open heart surgery. I mean, it's a huge surgery, and potentially side effect could be death. And does this reverse the heart disease? It does not. And the studies showed that it doesn't even prolong your life. And if you're having an event at that moment and you can't place a stent in it, then it may save your life. But for majority of people, they're having it as an elective procedure, and it doesn't even prolong the life. And another study came out and published in New England Journal of Medicine, and it showed that whether you have a stent or an open heart surgery, there's no difference in major heart disease outcome for cardiac death, another heart attack, heart-related hospitalization, or even resuscitation of a cardiac event when they compare to just managing that heart disease with drugs. Okay, so why are we having potentially very invasive procedure that doesn't really reverse the heart disease? Only thing it did was it reduced the chest pain and when somebody was exercising. So how do we reverse heart disease? So if you look at this study done by Dr. Esselstyn, many of you may have already read or seen this study. He was able to get about approximately 200 patients with a history of heart disease and who had cardiac events, put them through plant-based nutrition intervention. And then about 89% of them, 177, adhered to the treatment protocol. And then about 21 of them did not. And when he was able to compare the two, the one who adhered to it, there was a 0.6% of a recurrent cardiac event. There was one patient who had a very mild stroke. And then the group that has a non-adherent to the intervention, 62% of them actually had a recurrence of cardiac events. A pretty significant number. And then here on this side of the slide shows that this is the PET scan. And so this region right here, where it's disconnected, the blood should be flowing through. And so basically showing that there's an insufficient amount of blood that's flowing through this portion of the heart. But within 3 weeks of being on plant-based, was able to recirculate to this region. And this one, we'll see this portion again, but this is the angiogram of a surgeon at Cleveland Clinic who had a massive heart attack. And after going through a plant-based nutrition within 2.5 years, was able to completely reverse his heart disease. And this is a study that's done by Dr. Dean Onish, where it was a randomized study looking at a group who continued with their usual diet, standard American diet, versus a group that actually changed their diet and lifestyle. That it showed that the group that went on the plant-based nutrition was able to reduce and reverse the heart disease, while the usual care group continued to get worse over time. And then the plant-based diet group, 91% reduction in the angina attack, the chest pain attack, within just a few weeks. And then control group that continued with the usual diet was about 186% increase in the angina attack. And you can see, just like the previous slide, even in this study, this was a span of a year, there was a significant reversal of the coronary artery disease. And then this is a PET scan, again, showing this blue region shows that insufficient blood is flowing through the heart. And within a year, there's enough, the recirculation of the blood within this portion of the heart. So there were about 2.5 times as many cardiac events in the control group that kept with the usual diet compared to the plant-based group after about 5 years. And the 99% of the plant-based diet patients showed improvement within a year, and then improvement was able to be maintained even after 5 years. And this is the angiogram that you saw before. This is an angiogram of friends of Dr. Esselstyn and a colleague at Cleveland Clinic. And he thought he was healthy. He actually had a stress test before his heart attack, a few weeks before the heart attack. His LDL and cholesterol level wasn't that bad. However, he had a massive heart attack at the hospital. And if it wasn't at the hospital, he probably would not be alive. But after, because of where the heart attack occurred and then how extent it was, they couldn't offer him a stent or open heart surgery at that time. And so his only option was medical management. But after speaking with Dr. Esselstyn, he went on plant-based nutrition, and within 2.5 years, he was able to completely reverse his heart disease and atherosclerosis. And here are some of the other angiogram of different patients where this patient was also, after going plant-based, was able to reverse the atherosclerosis. So again, we go back and in order to reverse the heart disease, not just plant-based nutrition, but our goal is to really lower the cholesterol level, and not just to the normal level, but an optimal level, which is the total cholesterol level below 150 and LDL level below 70, and even down to the 30 if you can get there. Okay, and the way to reduce the LDL, the bad cholesterol, is really limiting the food that contains a lot of saturated fat, trans fat, and dietary cholesterol, and eating more food that's high in fiber. A lot of people, because I'm plant-based, always ask, how do you get your protein? The real question should be, how do you get your fiber? Okay, and those are especially especially the soluble fiber that comes in from the beans, oats, barley, fruits, and vegetables. Okay, and then choosing protein from the plant food rather than the animal based. Okay, and then also if you do whole food plant-based, most people just naturally lose the weight without having to diet, but losing excessive amount of weight will also help you reduce the cholesterol level. And when it's really high, your doctor also may recommend utilizing statin. But like all drugs, it also comes with the side effect. And there are a lot of people who can't tolerate a statin. And before you get on any kind of chemical medication, you should always try to do, modify your nutrition and your lifestyle, because for most people, they're able to decrease the cholesterol level. But some of the side effects of the statin is the potential liver damage, and then myalgia, muscle pain, and muscle damage. It also potentially increases the risk of developing insulin resistance that leads to type 2 diabetes. For women who have been on statin for greater than 10 years, they really increase risk of developing invasive breast cancer by 2 times. And then many people complain of memory loss and brain fogginess and then confusion with statin. But fortunately, not just the plant-based nutrition, but things that are natural food that comes from the fruits and vegetables that also helps you reduce the cholesterol level, like such as amla, which is also considered Indian gooseberry powder, which is the most powerful antioxidant known to mankind. And has many studies have shown that it can lower the cholesterol just as well as some of the statin drugs. Okay. So a way to reverse the heart disease is eating lots of dark green leafy vegetables, especially if you're trying to reverse it. I encourage you to eat them throughout the day, and because they contain high amounts of nitrates that would help you form the nitric oxide. Also, make sure you can add vinegar or balsamic vinegar, not vinaigrette, because vinaigrette contains oil, and vinegar will further help stimulate the production of nitric oxide. And then make sure you chew your food just like your mom told you. Because the bacteria on your tongue needs to mix with the nitrates in order to produce the nitric oxide, and eating food that contains a lot of fiber. Average Americans consume about 10 to 15 grams of fiber per day. And what I recommend is consuming 60 to 100 grams of fiber per day, especially if you're trying to reverse the heart disease. And we strongly recommend not utilizing any oil. As I stated before, it increases inflammation. It also causes damage to your endothelium. And also oil can cause vasoconstriction as well. Avoiding food high in fat. Of course, avoiding processed food and processed sugar. They always say, avoid carbs. Nobody really talks about and clearly define what kind of carbs. Is it complex carb or simple refined carbs? If it's simple refined carbs, you should definitely avoid it. But if it's complex carb that comes from the whole food of fruits, vegetables, legumes, and whole grains, pretty much you can have it as much as possible, as much as you want. And then avoiding all animal products, really to reverse the heart disease. Of course, avoiding salt and minimizing caffeinated coffee. So best nutrition lifestyle, I believe, not just for the cardiovascular disease, but also really to optimize your health, is a whole food plant-based nutrition. And here you'll notice, it's not, I'm not recommending the vegan diet because that's not specific enough, because there's so many vegan food that is processed, right now Beyond Meat and Impossible Burgers and the other meat replacement is becoming really popular, but they're not necessarily healthy food that's going to help you reverse your disease. And, and that's why I use the term whole food plant-based nutrition. And what I mean by that is whole, unrefined, minimally refined plants, the plants that contains a lot of fiber, because even certain processed vegan food, they process out all the fiber, so it has a really minimum amount, right? And so this is, what I recommend. If it's a green light, it means you can have pretty much as much as you want, fruits, vegetables, and then the legumes that contains beans and lentils and whole grains, herbs and spices are great because they contain a lot of antioxidants and they're very anti-inflammatory. And even they're plant-based things that are high in fat, such as nuts and seeds, avocados, olives, coconuts. You really need to limit the amount, and no more than a serving of nuts and seeds in a day. And of course, as I said before, the red light is all the animal-based products, and then also refined carbs and refined sugar. And those are the things that you really need to avoid. And so what I recommend is to prevent and reverse the heart disease. You want whole food plant-based nutrition, exercise on a regular basis, and avoid the toxins, whether it's alcohol or cigarettes. And I consider also like animal-based products as toxins as well, because they also contain endotoxins. And then also restoring through stress management, different techniques, whether it's meditation, yoga, because with stress, you elevate the cortisol level, which can further increase the inflammation. And getting plenty of sleep, 7 to 8 hours a day. If you don't, that also elevates the cortisol level as well. And then also maintaining good relationships as well. And all those things will help you prevent future heart attacks. Okay, so you have to make a decision. Are you going to be, some people think that plant-based nutrition is too extreme. They would rather have the surgery. Which one would you select? Would you go with the open heart surgery, or would you try the plant-based lifestyle to prevent and reverse the heart disease? Okay. So that's my presentation for today. If you have any questions, be more than happy to say as long as you want me to go over any questions. And then also to have discussion. If you've been practicing plant-based and if you have experience, if you have reversed the heart disease, or, and if you want to give us, your own testimony, please do so. This is, completely casual, and we want to develop a community so we can share ideas with everyone. So please, would really appreciate it if you share your stories also.
Patrick, if you don't mind, I saw that you had typed in a couple questions in the chat at the very beginning. Do you mind just unmuting and asking those?
Sure, no problem. Okay, so the first one I asked about was early on in the presentation, you talked about COPD as being one of the higher risk factors for the COVID-19 outcomes, or outcomes. So my question was, what effect, if any, does a whole food plant-based diet have on COPD?
Well, because with the COPD, it doesn't necessarily reverse it, but it helps optimize it and improve the symptoms, right? Because it improves, like I talk about the nitric oxide. Actually, nitric oxide is also being used as one of the treatment methods for patients who are having difficulty breathing, because it increases the blood flow, it increases the oxygenation. And then also with the COVID-19, some of the inflammatory process is by elevating something called NLP3 inflammasomes, and then nitric oxide tends to decrease that the production of inflammasome. So the plant-based nutrition, especially with the patients who have a COPD, will definitely improve their symptoms. It's not going to restore already the lung tissues that's gone, like in emphysema patients. However, it's going to really enhance their oxygenation, and then also increase blood circulation, so that they'll be able to breathe much easier. So we actually have experience with the patients who have been suffering from COPD, and once they've gone on whole food plant-based nutrition, they really improved with their symptoms.
That's very good to know. Thank you.
Absolutely. Pleasure.
And then I had a second question, if I may. You'd
sure,
mentioned
absolutely.
Yeah. Also, you'd mentioned in regards to the COVID-19 that maybe I didn't hear you right, but I thought I heard you say that 80% of the patients who go on the ventilator don't come off. Are you saying that they die?
Yeah, that's been the stat in New York, and then also some of the other countries. Unfortunately, 80% of the patients who end up getting on the ventilator end up dying, and wow. That's the stat. And that's why there hasn't been a lot of talk about how to really reverse the pre-existing conditions, because they say, well, if you have these pre-existing conditions, you really got to be careful, because you're at a high risk of developing a severe course, more likely to end up in the ICU. Well, but then, as you've seen in span of just 3 weeks, just few weeks, where you can really decrease the symptoms, and then also revascularize your heart, even you have severe heart disease. And so if they talked about that, even early on, many people may have survived. And so, but that's something that I think we need to be also talking about. We have patients who is for 13 years suffer from insulin-dependent type 2 diabetes. She was able to completely reverse her type 2 diabetes in 7 weeks. And within just first 10 days, she completely came off the insulin. And then within 7 weeks, she came off of all the oral medication. That's how fast it can actually happen if you just jump in and then and be really compliant. And so for the patients, what I tell all our patients is that right now is more than ever, it's so critical to really optimize your health, because there's, eventually you may get exposed to, COVID-19. And if you do, you really need to be prepared, right? And so rather than just reacting, you need to be very proactive. And this is not the last pandemic or the worst pandemic that we're going to face. There are more coming. And so we really got to prepare. But the good thing is that you have a complete control. And, without taking medication, you can really optimize your health. So you can prepare yourself for the coronavirus.
Yeah, sure. Thank you.
Sure.
Vera, if it's okay, I'd like to put you on the spot. You had asked some questions in the chat about LDL and HDL. Would you mind just kind of touching back on those questions, Vera?
I have a question. I don't really have cholesterol issues. My blood levels have always been normal. My homocysteine, CRP, HSC reactive protein has been normal. But then out of curiosity, because I follow Dr. Joel Kahn, who is also one of the plant-based cardiologists, and he is a strong advocate of lipoprotein little a. So I went to the doctor and I want to screen what my lipoprotein little a. This is the first time I had that tested. And it came up to 86. The reference rate for that lab was like 75 nmol per L. So 86 is kind of high. And I'm like, my LDL, HDL, and triglycerides, total cholesterol, everything is in optimal range. It's not even normal. It's in optimal range. So with the lipoprotein of 86, is this something that I should be alarmed? I'm a plant-based. I eat plant-based. I've been doing it for over 2 years. My mom reversed her type 2 diabetes, all her issues. She's 70. She reversed them in 3.5 months. So with the 86 lipoprotein little a, I'm kind of scared a little bit, although all the other numbers are in optimal range. Is this something to be concerned about?
Yeah, so that's why it is, I agree with Dr. Khan. He's a friend and colleague, and that there's 20 to 30% of the people who do have a genetically elevated lipoprotein A. And so, that's why it is important to know. However, it seems like you're doing everything right. By going plant-based, you're able to, control the others. You got to lower the LDL, you got to lower the total cholesterol, and do all the things that we were talking about before. Because if you do, your risk is going to be still lower. Let's say if you don't, and then your LDL starts elevating, and then you develop, chronic inflammation. Now that becomes really worrisome. And so, because a lot of times just the diet and lifestyle doesn't modify and reduce the lipoprotein little a. And if it gets to a certain point, then there's things that you can do. You can take like niacin, and there's a lot of potential side effects, like flushing and things like that. But that have shown to decrease your LPA by 10 to 20%. But if it gets really elevated, then only treatment method is taking the PCSK9, which is actually very expensive, and that may bring it down to 25 to 30%. But if you are able to do everything else, exercise, staying with the plant-based nutrition, decreasing the inflammation, really elevating the nitric oxide, then for patients even with the moderate level of LPA, you are protected. And the best way to protect your cardiovascular system is really, and Dr. Esselstyn and Joe Kahn, they all talk about the same thing also, really boosting your nitric oxide. And that is the best way to protect your cardiovascular system.
Thank you. So one more on COVID. How important is vitamin D3 and zinc in the prevention of COVID-19?
Yeah, vitamin D3 is actually very important for your immune system. And, I don't necessarily say boosting the immune system is optimizing the immune system, because the side effect from the COVID-19 is really your activity of your immune system, right? And so you want to adjust right. But vitamin D3 plays a very critical role. They've actually done the study with the SARS. With the COVID-1 is not 19 is not out yet, but at least with SARS, it really helps to reduce the effects from the SARS. But overall, for your immune system, vitamin D3 is very important. Significant number, 70% of Americans are insufficient of vitamin D3, which means it's less than 30. Okay? And then also, if you have dark skin, chances are you are definitely going to be insufficient or even be deficient, which is about 30% of the population. And so because the advantage that you have when you have a dark skin is that you're less likely to get damage from the sun. However, you're not able to activate the active vitamin D. And so I strongly recommend actually supplementing vitamin D3.
How about zinc?
Zinc, for it's the studies are mixed. As long as you're eating variety of food, like let's say zinc, there's a high concentration of zinc in the legumes, right? Then you don't necessarily need to supplement additional amount of zinc. But also the problem with the zinc is zinc has to get inside the cell in order to prevent the replication. And so, but in order to do that, those are some of the drugs that they're recommending, like the chloroquine, is that it allows the zinc to actually get into the cell, right? And so if you do take it, the recommended dose, there's really no harm. So I tell patients, if you feel, more comfortable taking it, take it. But if you have a well-balanced diet, that additional amount of zinc that you take is probably not going to do very much for you. So it's more important to get plenty of antioxidants, get, fruits and vegetables, and the legumes. And if you do, you're going to get all your vitamin C. And I forgot to mention also, especially with the lipoprotein A, you got to make sure that you take enough vitamin C. But if you're eating lots of fruits and vegetables, that you're going to get plenty of vitamin C, which is protector of the endothelium also.
Okay.
So, but the vitamin D3 wise, most people stay inside and work inside. And even depending on where you live, even you go outside and get the sun, you may not get the right angle of the UV ray. And so you're still going to be insufficient of vitamin D3. So I recommend people just, supplementing, period. And I do myself.
Thank you. Thank you very much.
Pleasure.
Would you share your slides? You mind? Will you email? Can we have copies of your slides, the presentation slides?
Yeah, we're going to have the recording available for people. And I think, obviously we'll edit it, but then so you'll definitely be able to have it.
All right. Thank you.
Kellis,
Pleasure.
Kellis, do you want to go ahead? You had a question in regards to your son.
Oh, yes. Hello, Dr. Juan. My son is underweight.
You're not talking about that.
Oh, my son is underweight. He weighs 105 pounds, and he's 21 years old, 5'8". We're vegans. My question is, how can he safely maintain a healthy weight, possibly gain weight, while following this diet? He does eat nuts and nut butters and oils and avocados, and I see that some of those things we will have to cut down on for the healthy heart. So I don't know what to do to help meet all of his needs.
Yeah, and so a lot of times it becomes a calorie per calorie, and then even within the plant-based food, there's a food that's more calorie dense, right? And so you do want to take a caution of eating a lot of nuts and seeds or butters that are really concentrated. But if you eat from the natural sources, also like you mentioned, avocado. And then also the beans, and then whole grains. And if you get them well balanced, and then also just making sure that it gets enough calories. Sometimes the challenge with the whole food plant-based for certain people is that your stomach gets too full, right? Because there's the calorie, very limited calorie density. Like, for example, a pound of broccoli is about 120 calories. And it's the same amount as a tablespoon of olive oil, which is 120 calories also. And so you want to lean more towards, especially if you do want to gain more weight, eating food that's more calorie dense. And so, you send me a message, and I can definitely also make further recommendation as well.
Okay, thank you very much.
Sure, pleasure.
Doctor, in regards to her question, will helping treating the microbiome be of help for such a situation?
Yeah, I mean, by eating plenty of fiber, that is the best way to really maintain healthy microbiome, right? And so a lot of times the microbiome has an effect where it's strongly associated with that microbiome has association with obesity, right? Because people tend to not have the optimal and diverse microbiome that is strongly related to the obesity and inflammation, other chronic disease. But if you're eating whole food plant-based and getting enough fiber, then you are going to achieve the most optimal microbiome. And also, spending enough time outside, the other things that I recommend for microbiome wise, this is tough because, we used to say people over sanitize themselves, and then getting rid of all the natural microbiome or taking too much antibiotics, which also each time you take a course of antibiotics, that it wipes out about a third of your gut microbiome, and then you have to rebuild it, right? And so you have to be conscientious. But then now, we're asking everybody to over sanitize themselves, and so but there's going to be a fine balance. But also, most of the gut bacteria that we the soil bacteria. So even gardening, for example, really enhances the gut bacteria. And then also having a dog, for example, because dog goes outside, steps on the soil, brings back that gut, the bacteria to the house. You interact with the dog, and then that actually has shown to help you optimize your gut microbiome also. So those are some of the things that you can do for microbiome.
Thank you.
T, I think you're talking, but we can't hear you.
It's not my first Zoom call, I promise.
Yeah.
Linda, I was looking in the chat. I know you don't have video, but are you able to use your audio to touch on your question from the chat room?
Hi, yes. I was just wondering about people who have religious practices and they are only plant-based. They still suffer a high proportion of diabetes, for example. Not sure why, in some cases, people who switch to plant-based reverse diabetes, yet some people with traditional foods in plant-based develop diabetes.
Yeah, great question. What we have seen, and it really, plant-based is also a very loosely used term, right? Because a lot of people, depending on who you talk to, some people may consider that as a whole food plant-based, or some people may consider that as, same term as a vegan. Because there are a lot of vegans that I know that are very healthy. There's also a lot of vegans that I know that are very unhealthy. And so when you're eating, especially what I've seen with people who are, let's say, plant-based for the religious reason, they're eating a lot of meat replacement that are processed. They also eat a lot of processed food. They also eat a lot of refined carbs. And therefore, either they're overweight, and with obesity, that will lead to insulin resistance and decrease in nitric oxide production. They also, then they may develop diabetes as well. That's why I strongly recommend, you're so close, you're not, eating animal-based products to begin with. So then now, we need to make effort towards eating really unrefined food, and majority of them being raw. I don't really also define them to be raw, because if you're eating salad, they're raw anyways, right? So if I calculated, I would say, 70% and to sometimes 80% of my calories comes from probably a raw diet. But I really do enjoy cooked food. So, I make sure I get those. But for those groups, you may want to look to see what are they really eating. What are they having for breakfast, lunch, dinner? Are they eating a lot of processed food? Then those are the group of people. They're gonna tend to have more diabetes, also have cardiovascular disease. Also, are they getting enough nutrients? One thing I mentioned is if you're eating completely plant-based, 100%, you definitely need to supplement vitamin B12. Because if you're deficient of that, you may have some, with the blood cell issues, you may get elevation of a homocysteine that would also increase the risk of, cardiovascular disease. And so I strongly recommend everybody supplement with vitamin B12 as well. And even your majority of the population are actually deficient, and even the people who are eating meat, at the factory farm, they actually supplement because the animals themselves, B12 comes from the soil bacteria, and so they can't produce enough for themselves. So it's supplemented. That's why B12s are in the meat products. So essentially, you're going through middle person to actually get the supplement that was supplemented to them. But that's my response to your questions about some of the other people who may be vegan or plant-based, but they still have health issues.
Yeah, can I just confirm? I have an understanding that it's a bit related to like belly fat or having that pear-shaped body. Mm-hmm. And if you could explain a little bit of how to address that, how to reduce that shape and change it to a more healthy body type.
Yes, another great question. The reason they are kind of like a pear shape is because they tend to collect more visceral fat. And so basically from all the chronic disease, in a way, we're beginning to now look at it as the same disease, just manifested differently based on different genetic makeup, whether it's a heart disease or diabetes or cancer, autoimmune disease. And then so solution is very similar. Eating the food that we were naturally made to eat, which is majority of it is whole food, plant-based. But by doing that, you are naturally going to lose the fat. And especially for people who have type 2 diabetes or insulin resistance, main cause of it is two main cause is called intramyocellular lipids, which all that means is that fat inside the cell. So once you lose it, you become a lot more insulin sensitive. And then also with the depletion of nitric oxide, that also creates insulin resistance as well. And so by going whole food plant-based, most people are going to be losing a pretty significant amount of weight, and sometimes in a very short amount of time. And then that will definitely help you lose the visceral fat, basically the fat around the belly.
Thank you.
Sure.
Yeah, I have a question, Doc.
Yes.
That's in regards to the B12 that you recommended. So for someone who is has methylation issues, right? Will taking a methylated B complex be substituted for the B12, or it needs to be a standalone B12?
Yeah, so they say about 40% of the population are not able to methylate it. And so for general population, you can just take like the regular B12, which is a cyanocobalamin. Mm-hmm. But even methylcobalamin, it's pretty inexpensive. They're about the same. So if you don't want to worry about it, then, I say just get the methylated cobalamin. There's a different opinions based on different science and among the physicians and scientists. And, I'm with the camp that I just go ahead and take the activated, because that, I don't necessarily want to worry about that 40% of the population.
Mm-hmm.
And so go ahead and take the methylated cobalamin. But if, for others, if they've taken the cyanocobalamin and then they've done the B12 blood test, and if it's a normal level, then you're perfectly fine. And so you can also ask your primary care physicians to check the levels, right? Check vitamin D levels so that you can, optimize your level. Same thing with the vitamin B12. So you can get those tested when you get the annual blood workup or the time when you do see your primary care physician.
Doctor, do you know which type is in Bragg's nutritional yeast that they fortify it with?
That I don't know. I imagine it would be the generic kind, which is typically cyanocobalamin.
Yeah.
I was going to ask a question for Esther. She is no longer in here with us, but she had put a question in the chat that I've heard a few times. And she was asking, does she have to buy everything organic? And if not, she heard baking soda gets rid of pesticides from fruits and vegetables. What are your thoughts on that?
Yeah. So there's a list that you can find on the internet. Dirty Dozen, and then Clean 15. So there's a not-for-profit group that every year that measures all the pesticides and publicize. And so for the Clean 15, like something like the broccoli and then avocados and those type of things, that also, especially the ones with the thick skin that you're not going to eat, you don't really need to waste your money on buying the organic. And if you want to and you can afford it, that's perfectly fine. But the ones they list under the Dirty Dozen, those are the ones that sometimes it is difficult to wash because most of the fruits and vegetables with the vigorous washing, the study have shown that you can get 95 to 98% of the pesticides off, and so that really has a limited effect on you. So as long as you rinse them and wash them vigorously, then most of the time you're fine. And then they even had different kinds of cleaning solutions for the fruits and vegetables. The study have shown they were no any better than just water. So I know some people use baking soda if they want to do it. That's fine. But what I typically do is the things that are on Dirty Dozen, I buy them organic. If it's in Clean 15, and then I buy just the regular kinds. Like bananas and avocados and then all of them I'll wash them vigorously before we consume them. So
very good. I think I've gotten through everybody's questions on the chat. If I missed one, I apologize. Is there anyone else that has any questions they'd like to get in before we finish up?
Yes. I put down a couple of questions, but I was never asked. May I interrupt?
Yes, please.
Oh, yes, absolutely.
Thank you, Dr. Wen. I saw in your presentation you say boil your vegetables like 5 to 6 minutes. Will that deplete a lot of the nutrients like vitamin C and things like that? Or could I just take it like salad raw? I mean, is it any importance fact that you have to boil it 5 to 6 minutes?
Oh, no, it just makes it easier for you to eat. That's been kind of like the protocol that was initially stated by Dr. Esselstyn, and a lot of cardiologists use it because, like, as an example, like once you, spinach as an example, right? Once you boil them, I mean, you could get a whole bag, but then by the time you boil them, I mean, it's just a really limited amount. So what we're saying is that, once you, let's say, lightly boil them, like eat about a fistful, which means before you actually boil them, it's going to be pretty large quantity, right? It's going to be almost like a bag full of a green leafy vegetable. That's how much we want you to really eat. And on average, what I recommend is eating about a pound of, dark green leafy vegetables in a day. It's really hard, it's a lot of green leafy vegetables to chew. And so, when you boil them, it kind of shrinks them down and makes it a little bit easier. Or like kale, for some people think it's really tough, and then it makes it a little bit easier to chew. And then also, you may lose a little bit of a nutrient, but that's why you're just lightly boiling them. And so you still, retain most of it, but also the cell membrane of the plant gets a little bit easier to digest. So there are, both advantages and disadvantages, but I do both. I love salad, and then I eat them, obviously raw all the time. And then also if I'm making a soup, I always add just, really large quantity of green leafy vegetables. And by the time it's cooked, it just becomes just a, tiny little bit. And then also I tend to eat, add some form of vinegar all the time. Like first thing I wake up in the morning, I also drink a large glass of, water along with like an apple cider vinegar. Not because it's an apple cider, but because it's a vinegar, helps stimulate my enzyme. Also, some people who are, trying to lose weight, vinegar also helps speed up your metabolism as well. And studies have shown that also helps you lose a few extra pounds. But vinegar overall is very healthy, but not vinaigrette because it obviously adds the oil.
Okay. Second question I have is like, how about, you say like fish, it's no, but like, how about like oily fish, like salmon is supposed to have this omega-3 oil, which is supposedly very good for you. So what's your comment on fish?
Yeah, for me, the fish themselves, I mean, it has omega-3, but it also has saturated fat. Also, the fish, almost every fish has a lot of toxins because they're contaminated. So I just try to avoid them. And then also, you don't know whether it's a wild caught salmon versus farm raised. Because they also have a lot of antibiotics and even in the fish, and then also a lot of toxins. And so I just like to keep it clean as possible. And you can get all the omega-3s that you need from, I get it from flax seeds. Each day I consume flax seeds, chia seeds, hemp seeds, and, walnuts. And then if I'm away and let's say traveling, I don't have access to those. Then I also have algae-based EPA and DHA to get my the omega-3s. So because also almost every single fish oil capsule that has been tested actually has contamination. So I try to avoid them, and so that's how I typically get my the omega-3s.
Thank you. I just unmuted myself. Thank you. One last question. It's
Sure.
like my PCP basically stress your LDL over HDL ratio, so that they say, oh, I look at my total cholesterol, say, 170 is not bad because your HDL is so high and da. So, but you did not mention anything about this ratio. I mean, like, please comment.
Yeah. Great question. And so very observant also. We don't talk about the HDL anymore because there's the old thought that you got to have the high HDL and then low LDL. But all the study have shown having an elevated high HDL, which we thought we wanted, doesn't really prevent you from developing another cardiac event. And so if you have a high HDL, and it says, yeah, it's good, but it really hasn't shown any positive effect, because you'll notice somebody who has a really low LDL will also have very low HDL, because your body doesn't need to make that additional amount of HDL. Essentially, you can think of it as, HDL is picking up the cholesterol and bringing it back to the liver. But if your LDL is low enough, then you don't really need to have elevated HDL. And so that's why that ratio, if you have a low LDL, then I don't really worry about the HDL or even the ratio. So it's more important to focus on the total cholesterol and then more specifically the LDL, and then also if you do get tested, the LP little a also. So those are the things that I typically look at. And they have a strong association with, if you have a high LDL, obviously, then strong association with, another, cardiac event.
Thank you.
Sure, pleasure.
What about, you had mentioned the, cases of people reversing diabetes with whole food plant-based. What about the effect of whole food plant-based and nitric oxide on non-alcoholic fatty liver disease?
Yeah, so I mean, I think for alcoholic related fatty liver disease, there's some different. We looked at several different mixed studies. Some really didn't do much, and then there's some that also seems to be helpful. And so I think those are still a little bit mixed on in that specific group. But as long as you can elevate the nitric oxide naturally through the whole food plant-based nutrition, and then with the dark green leafy vegetables, I think it would be very helpful for those patients.
Thank you.
And I think also somebody asked, how do you take Indian gooseberry powder? Yeah, so there's several different ways. You can buy in bulk also. I would recommend getting them organic, like at the Indian grocery stores. But those, it is like one of the best antioxidant, and then it's the strongest antioxidant food that you can take. As an example, for blueberries, and then like pomegranates and goji berries are around 3,500 to 4,500. As far as the ORAC score, that's how you measure the antioxidant. And then you get the ginger, which is about 60,000, and you got the turmeric, which is 120 to 130,000. So that's why the spices are very antioxidant, has a lot of anti-inflammatory effect. But for a berry, Indian gooseberry, I mean, it's nothing really higher than that, which is like 261,000. But only bad thing is that it really tastes bad. It's really sour, and most people have a distaste for the taste of it because you get it in the powder form. But you can add it to your smoothie and to hide the taste. Also, you can definitely, there's also capsules that you can purchase, so you don't have to actually taste it. And so those are some of the other methods. But I strongly recommend food like the Indian gooseberry because it's very natural. It helps manage your blood sugars. Also has shown to lower cholesterol, as I mentioned before. So there's a lot of benefits to amla. Some people call it amla, but also it's an Indian gooseberry powder. Don't get confused with the Chinese gooseberry powder, which is completely different. And then also they're mostly produced in India, and you make sure you get them organic.
I have a question on the medication that I'm taking. I've just recently started on plant-based, and I am guilty of taking all the bad medicine you talk about, statins, beta blockers, and cholesterol medicine and stuff like that, high blood pressure medicine. How would you recommend people to transition out of say beta blockers? I've had something called Barrett's esophagus. And then also for the cholesterol, I've been taking statins and some high blood pressure tablets. How do you recommend that one would transition out of that?
Yeah, so I definitely would, since you are taking those medications, we don't recommend people coming off of those medications, on their own. You want to definitely work with your primary care physician. Because you want to let them know, hey, this is the new diet plan that I'm practicing, and then your blood pressure is going to decline, and your blood sugar will improve, your cholesterol is going to get lowered, And so you do want to let them know so that they can make adjustments to your medication.
Okay.
Okay.
Thank you.
Yeah, definitely let them know. And then, and sometimes you get, depending on who they are, you'll get different kinds of feedbacks. Some may say, why are you doing it? Or some, they don't really know anything about it. And some people think, a lot of the physicians think that, whole food plant-based is the same thing as a vegan diet. And then they say they're going to tell you that you're going to be malnourished or nutrient deficient. And because, physicians on average get, 1 to 4 hours of nutrition training in medical school. So I had a personal interest on nutrition and, longevity and optimal health. But everything that I learned was outside of a medical school and residency training. And most physicians really have no clue. So,
okay. Thank you.
Anybody else?
Yes, I do have another question, if I could.
Yeah.
Doctor, in your presentation, you had a graph of the nitric oxide production with age, and then you did with the different diets and lifestyles, and it was all headed downhill. Also, just with the endothelium being destroyed or I guess damaged throughout life with standard diet, and then switching to whole food plant-based diet. I've heard from Esselstyn and others that the endothelium can repair or will repair. And so does that downward graph just say that it's going down less fast than it would if you don't have a whole food plant-based diet, or is there any hope to go back to be a 30-year-old again?
Yeah, I wish that would be the case, but who knows? But most likely, it depends on when you intervene, right? And if you do it as early as possible, because after age 20, it starts to decline really fast.
I missed that by 45 years.
Yeah. And so I think the best you can do is really to slow it down, I think, but even then that would make a huge impact, because for most people, by the time you're 60, you lose about 85%. And that is the exact reason, why people develop heart disease. And then there's people develop diabetes, type 2 diabetes, right? And because they develop insulin resistance. And then there's many other functions, because it also, not just for stem cells for endothelium, it also is critical for activating stem cells everywhere else. That's why our stem cell clinic, because a lot of our patients refuse to make changes to their diet, but they still wanted to do orthopedic related stem cell therapy, we needed to find a way to also help them elevate the nitric oxide. So, we obviously strongly encourage them to have dark green leafy vegetables, but a group of stem cell therapy physicians came together and then created a nitric oxide booster. But there's many other function, and nitric oxide also has a lot of anti-aging effects. Great for your skin and your hair, but it plays a significant role because it's a signaling molecule. So it's critical for your nerve health as well as your cardiovascular health, and then and vascular health and diabetic health. So, so the best we can do is try to boost it as much as possible. That's why
will the endothelium repair to some extent, or are the
absolutely.
Okay, but they're not lost forever.
No, that's how we're able to. When I say actually reversing the heart disease, that means actually restoring some of the endothelium. And that's why you actually seen, like in the angiogram that you saw, somebody who had a plaque and narrowing of the blood vessel, right, and then it became normal again. What that means is that they got rid of the plaque, and then endothelium was restored, and that's how you're actually able to reverse the heart disease.
Yeah.
So you can definitely. So that's why it's a fine balance, because that's a primary still the primary source. And then the secondary source of the nitric oxide is a nutritional pathway by eating. And so by nutrition pathway, which is called nitrate pathway, you're able to restore to a certain degree. So then that is going to help further develop the endothelial pathway to produce the nitric oxide. Once your endothelium is healthy enough, then it's going to start regenerating the nitric oxide.
Yeah, interesting.
Yeah, so you can definitely restore the endothelium.
Okay. One more question, if I could.
Sure.
You're talking about omega-3s in the flaxseed and chia and all those. In your presentation, you said something about eating a half a cup of flaxseed per day. I've heard others talk about a couple of tablespoons a day. So kind of where is the balance on that?
Yeah, I usually have about a couple of tablespoons.
Okay.
And so I got to double check the presentation. And so usually that's about, what I consume, about a couple of tablespoons per day.
Good. I was going to have to take out a loan or something to eat a couple.
Yeah.
Expensive.
So sometimes, for, let's say there's certain group of patients, let's say like patients who are suffering from autoimmune disease, that the protocols we use them is we hyperdose them with the omega-3 along with the green leafy vegetables. And so for the also we have in the smoothie recipe, we put in the half a cup, but then for a lot of people, it may last them about 2 days or so.
Yeah.
And also, if we're trying to really restore their gut health, then we may hyperload them with the omega-3s. But for general population, I would say 1 or 2 tablespoons of flaxseed would be ample.
Great, that's good to know. Thank you.
Yeah. Great. Anyone else?
May I have one more question?
Oh, yes, sir.
I don't know how to start. I have an acquaintance who has a PhD in biochemistry or something. And every time we have a conversation, he has been pushing this keto diet. I mean, high fat stuff. But I don't want to get into that because it will probably go on for a long time. But he made one point that saying that a plant-based diet, if you don't have meat, you don't have complete amino acid for your body to function. So I just want to go to that particular point that he has been pushing.
Yeah. So almost anything that you eat has actually a complete list of all the amino acids that you need. It may have a different degree, right? So like in 1970s, one lady wrote an article where in order to have a complete amino acid, if you're plant-based or you're vegan, that you need to eat different foods together, which that's been debunked a long time ago. It's amino acids and amino acids, no matter where you get it, right? And then so as long as you eat enough calories most of the time and variety of food, you are going to get enough amino acid. So protein really becomes no issues for people. Even you do whole food plant-based. And then also, and it's a cleaner source. It doesn't come with all the baggages. And so what he's talking about is what they thought was a science back in 1970s. And it's absolutely wrong because, if that's the case, you wouldn't have more professional athletes who care a lot about protein are becoming plant-based and leaving the animal-based protein because they're performing better, right? And then also all the studies have shown that you do low-carb, high-protein diet, it elevates your all-cause mortality, especially if it's a meat-based protein diet. It increases your all-cause mortality by like 30%. However, that wasn't the case if it was a protein-based diet. But you don't want to consume too much protein, more than you really need. And then there's overconsumption of protein in this country, and because everyone thought low carb diet. I myself are guilty of that, because I didn't know when I first came out of medical school. I wanted to lose some weight, and then everyone at the hospital said, "Oh, I do a low carb diet." So it's grilled chicken and broccoli all day long, and then you may lose the weight initially because you lose the glycogen, so you lose the water weight. But then most people, gain the weight right back, and it doesn't work. And those people are really lacking antioxidants, and then all the food with the anti-inflammatory properties. And so I'm strongly against meat-based ketogenic diet, and also NIH, National Institute of Health, did the study, and then sponsored by the Paleo and Ketogenic Society. And the study came out that it really did not, most people who lost the weight gained everything back, and then it's not sustainable. And they've never been able to actually do a study where they can actually reverse any kind of chronic disease. And you will initially lose weight because you lose mostly water weight. But it's a very difficult diet, and it's not really sustainable. But now they're showing that people, their cholesterol level elevates significantly. And there's a group of people who says, well, your cholesterol level doesn't matter. Well, it may not matter if you don't have inflammation, but everybody has inflammation and they have oxidative stress. And then so, it just satisfies the type of diet that they want to have the day to day. So I just got to go with the science, and science really doesn't support the ketogenic diet.
Thank you.
Sure. Anyone else?
I've got a question for anybody, I guess, who is successful, who is on a plant-based diet and who has successfully been able to get the conversation going with their spouse without leading to divorce about changing their diet. Any tips from anybody?
I mean, I was on the receiving end of that. I was the non-plant-based person in the relationship. And it started out with, my girlfriend, she was vegetarian when we met. And then shortly after that, she went plant-based. I was, I like to cook. And so I was cooking 2 different meals, every time for dinner. I'd cook my meal and I'd cook her meal. And I kind of got tired of doing that, every once in a while. So occasionally I would just eat what she was eating, which was obviously vegetables and that sort of thing. And kind of just through that experience of, eating the same meal as her on those nights where I was just feeling, lazy, it actually showed me that, like, wow, this is actually great. Like, I was really enjoying those meals. I was satisfied after them. Mm-hmm. And so, I'm kind of coming from the other side of your question, but it was really just through the experience of, I think there's a lot of hesitancy when it comes to someone thinking about switching to a plant-based diet because of what they're about to miss out on, or, how good the, food is, the flavors and all that kind of stuff that they're eating, and they think it's all going to disappear. That was kind of how I, was. And I said, maybe I could go vegetarian. She loves telling the story. Maybe I could go vegetarian. I just couldn't give up queso and, cheese and like that kind of thing. But once I just kind of got the experience and understood that plant-based diet wasn't kind of what the stereotype seems to be, like a bunch of seeds and nuts and, leaves. And it's more than that, that really helped me understand it and actually want to give it a chance. And then I think everyone's different in terms of, learning and how they get their information. But I'm a documentary person by nature, and I just had happened to stumble across a couple of different documentaries like What the Health and, Game Changers. And, with like just my personal family relationships and people that I want to share this information with, a lot of times either cooking something for them that just blows their socks off, or showing them, one of those documentaries or watching it with them, because they're very palatable and easy to digest, ends up really kind of being the icebreaker I've noticed. And then, like I said, just through my personal experience with my girlfriend, I was I'll never go plant-based person. And it was really through just gaining some reference points that, now I'm over 2 years, into it. So I don't know if that helps you out at all, but
yeah, that's interesting. So you tasted some, and it's kind of like your gateway drug that got you going. But
yeah, I mean, I just assumed that, if someone said they were vegan, I instantly thought it was, weird, because I just didn't really know anything about it, and, now I'm on the other side of that, and I got people thinking I'm weird, in relation to it, which is fine. But I think it's just, everyone has their different reasons, and it's okay for people to have their reason for what gets them, to the conversation. So I think the entry point is going to be, different for everyone, but I think those are some good ones to, you see something online that's interesting, a quick little blurb or something you saw on social media in relation to it, doesn't hurt to share it with them, or just bring it up, casually. But I think it's something that it's going to take a different amount of time depending on, who you are, and someone has to want to participate in it to.
Yeah, that's the key. And because what you eat is very personal, and for some people it's very sensitive, and sometimes it's just a subject that you can't go there. But
yeah, and that's even the case with some patients also. I recommend that certain patients, and then they thought I was crazy, and they said they would rather have surgery, or had some patients who actually walked out of clinic because as a surgeon, I was recommending certain diet. And then they asked me about the blood type diet, because that's what they were on. And then when I, politely disagree with that, type of diet, then they said, one patient said, "You're a quack," and then got up and left. I said, "Well, you can't make everyone happy."
Yeah, it's almost like people think of their body like a car, and if it breaks down, take it to a mechanic, and he's supposed to fix it.
Yeah.
If he can't fix it, then he's not any good. But it's not like a car.
Well, I mean, sometimes I actually tell them they should treat it like a car, right? And then because for maintenance, or even as a fuel, right? So you're not going to put a diesel gas in an unleaded car, right? Because it's going to break. But for most people, they put the diesel rather than super unleaded into their car every single day, right? And then also, I think the Warren Buffett actually said this. If somebody gave you one car, you can only have one car for your entire life. How would you take care of that car, right? And then, just what everybody said, they're going to be gentle, they're going to maintain it, and they're going to take great care of it. And they say, well, you only have one body. How are you treating your body, right? And so I don't think he was necessarily talking about plant-based, because he's not anything close to plant-based. But it's a good way to think about it. What if you only have your body once, and you live only once? So if you want to live long and healthy, then what you have to do.
Yeah.
So
a lot of times that's the most difficult part of this is trying to convince others without getting the relationship in trouble.
Yeah, especially family members. Anybody else had issues with their family members?
Yeah. No, not really, but I think you can suggest you use the argument of to supplement the plant-based benefit of protecting the environment and the ravages of the big food industry and the animal food industry. It's devastating to the planet.
Mm-hmm.
Yeah, you're absolutely right. I mean, once you start doing it, you also realize that it also the factory farms and how it really destroys our planet. And then also obviously there's a cruelty to animal issues, but
and pandemics.
Yeah, absolutely, and pandemics as well. So and that's why more and more people really do need to pay attention to minimize the effect in the future, but also to if it does it's not if, it's when it comes back. I mean, we're still in it, but are you prepared to deal with it?
Cool.
Well, and omnivores tend to eat everything plant-based people eat as well. So it's not like it's weird food. I mean, I've been over 2 years plant-based, and I kind of did it to lose some weight without exercising, and it worked. And but I've like had maybe tofu twice in the 2.5 years. Like I've never eaten it before. I still don't. So it's not like it's not weird food, right? So plants are the stuff that everybody eats.
Right. Yeah. How much weight did you lose when you went plant-based?
About 20 pounds. I had just got to the point where I had to buy the next size up suits, pants, and move the belly over to tie my shoes. So I'm like, it's just.
Yeah, I think that's one thing that surprises a lot of people. It really surprised me. And when I went plant-based, I weighed about 220 pounds. I'm 6'2", so I can kind of spread it out pretty good and hide it. But I was about 220 pounds, and in a little less than 6 months, I ended up getting down to 170, to 173. And that was literally just through diet. I wasn't starving myself. I was eating as much food as I wanted, but it was all plant-based. But people were commenting left and right on the weight loss, asking what I had done, what kind of workouts. It's like I haven't worked out at all. So it's crazy how that happens like that, just through that switch.
Yeah, and I had no ideological commitment to it at all. Mine was just sloth and vanity, and I figured the first Thanksgiving afterwards, I was going to have some turkey because, again, I'm not sort of committed. I didn't have any underlying health issues. And anyway, so my brother-in-law is an amazing cook. And so we're having Thanksgiving at his house, and he made these amazing plant-based dishes. And I looked at that ugly turkey, bland, whatever plates. I'm like, no, it looks ugly. I don't want to eat ugly stuff. So I've never touched animal products since then. It's just it feels good. And when I travel and eat whatever the junkier vegan stuff is out there, when I travel for work, I just crave the stuff I can make at home. It's really whole food plants.
Yeah, no, that's awesome. Well, Dr. Juan, is there anything you'd like to finish with?
Well, I just want to thank everybody. Also, once again, happy Mother's Day for all the mothers out there. And then, thank you again for joining us. And love to, we'll send everyone an email. Love to hear from everyone, getting feedback, what you like, what you don't like. Like to, really build a community. And so, this would be a community for everybody. So, how you see this community to grow. And we'd love to get suggestions and feedback from everyone. So we really appreciate that.
Thank you, Dr. Juan.
Just to reiterate on that, we will have that email out to you guys this week, just on a little follow-up. We'll have the recording there so you can reference this information, or you can feel free to share that link with friends or family. And then also, if you have any suggestions on any topics you'd like us to cover, obviously we've done plant-based nutrition and the immune system, reversing heart disease. Tonight we had a request last time for autoimmune disease. So if anything like that pops up, you can always email us or contact us on any of the social media channels. And in regards to the product giveaway, definitely made note of everybody whose camera was on. So I see you. And one of you will be getting an email this week letting you know who won. And then we'll just need your address to ship the bottle of NeoNox the nitric oxide activator to you. But unless anyone has anything else, just want to say thank you again and have a wonderful evening.
Thank you very much.
Thank you.
Thank you, everybody.
Thank you.
Thank you. Thank you.
Thank you.